And to start off with a few team introductions, my name is Layla and I am a Senior Employment Services Advisor, so essentially a job advisor in the Western region of UpGlow. And I know some of you, I work with some of you, but for those who I don't work with, I just wanted to kind of give you context. I work with mostly healthcare, upwardly global candidates. So next, I'd like to introduce my colleague, Tamar.
Thanks, Layla. I am so glad to be here. I am also a career coach and advisor based in Chicago. To MD who's saying we have no voice. Are you sure that you are attached to your speakers on your computer? I'm guessing that other people can hear me. If there is a big lack of sound, we will adjust, but I'm guessing MD, it's your computer. So I'm Tamar. I am a job coach in Chicago, and I'm also the head of the national healthcare team. I know some of you. I'm excited to dive into this material. I want to just let folks know that this is really a talk about the basics of the U.S. healthcare system for those who are interested in working in healthcare. So if you are interested in being a patient or a customer, this is not so much the webinar for you, although we'll share some links at the end. On the Upwardly Global website, there are some resources there that you can also look at to learn more. So we will take it from there, and I would like to introduce my colleague, Kiri.
Hi, everyone. Thanks so much for joining us. I'm also a job coach based in the New York region, and I'm really excited to enjoy this presentation with all of you today. And next person I will pass it to is Ari.
Thanks, Kiri. Hi, everyone. My name is Ari Weinstein. I am an employment services advisor with the Washington, D.C. DMV team. It's a pleasure to be here. I'm looking forward to learning with you today. And I've seen some people have started to introduce themselves in the chat. If you'd like to do so, please feel free to introduce yourself. If you want to include a little bit of information about your profession, your LinkedIn, feel free to connect with other folks on the call. And I'm going to pass it over to my colleague, Rebecca Fishman, who looks like she is on the call. Rebecca, I don't know if you were planning to introduce yourself.
Hi, everyone. I'm Rebecca Fishman. I'm based in Durham, North Carolina, and I work at UpGlow on special projects across the organization, including very closely with the healthcare team. My background is in U.S. healthcare administration as well as global health, so I'm very excited for this call and really excited that our special guest speaker, Sadiq, is joining.
Thank you, Rebecca. And Ariel Reynoso, would you like to introduce yourself as well?
Hello, everyone. My name is Ariel Reynoso, not to be confused with Ari Weinstein. We both have very similar names, but I'm the Partnerships and Volunteer Program Lead for Upwardly Global's DC region, and I also work here with the healthcare COP as well as the engineering COP. So great to be connected with you all today. I'm excited to learn with you all.
Thank you. And so next, Tamar is going to give a little agenda kind of introduction of what we'll discuss today.
All right. So as I mentioned, we're going to talk a little bit. We're going to talk about the healthcare system in the U.S. From the point of view of our job seekers who are looking to work in healthcare. We know that many of you, both in healthcare and also with backgrounds in IT, or business or nonprofit might be interested in this kind of work. So we want to give you an overview. We're very, very, very excited and happy. We have our alum, Sadiq Hazratzi, who's going to talk to us a little bit. He's actually a professor of public health and a researcher. He's going to talk to us a little bit about his experience and share some knowledge from a sort of high level about the healthcare system in the US. We're also Layla and I are gonna dig into some career pathways, including medical assistant roles, public and community health, clinical research, medical billing, and coding. These are gonna be kind of high level overviews of some of these pathways. We have some additional webinars and materials we can share if there's an area here that you're particularly interested in. We're going to share a few resources and then hopefully have about 10 minutes at the end for questions and answers. So that is our agenda. I hope it's consistent with what you were hoping to hear. And we will jump in now. So we know that the healthcare system in the United States is very different from where you all come from, because it's different from everywhere in the world, and we're very lucky that Sadiq's going to dive into it. We imagine you've already dealt with, if you are healthcare professionals from other places, the challenges of regulation within the US, and now we're trying to figure out, in terms of next steps in your career search, the organization. We have a complicated system. We have hospitals, we have independent providers, we have federally qualified health centers and public health. So there's a lot going on, and we want you to start thinking about your questions and thinking about how to research and figure out where your place in this system is. We also are very aware it's an expensive system. It's a market system. Many places in the world have government sponsored healthcare or other ways to provide healthcare. And in the US, we know it's complicated. As someone who was born and raised here, I find it complicated. There are lots and lots of resources to research how private insurance works, what Medicare is, which is a federal program for that provides coverage for people 65 and older and people with disabilities, and Medicaid, which is a state and federal program that provides health coverage for low-income people. That is a very, very simple overview of some of the pieces. There are also people in our system who are not insured, and they are paying for the healthcare themselves. So all of it to say, there's lots to learn. It's very complicated. We're hoping to give you a few nuggets of information and some ideas of areas to research moving forward.
Thank you, Tamar. And I'm happy to introduce our wonderful Upwardly Global alumni, Mohammed Sadiq Hazratze, who entered the UpGlow program in 2018. He originally hails from Afghanistan, but he's also worked and studied in Kyoto, Japan. He holds an MD and a Master of Public Health and PH. He has over 10 years of work experience in research and management of public health programs, including with the International Organization of Migration and the Ministry of Public Health of Afghanistan. He took on the position of data collection specialist with Public Health Institute in 2018, and since then he's been promoted to his current role of principal investigator. Additionally, in January 2020, he started as visiting professor with the University of California, Davis School of Medicine and the Refugee Health Research Project. I'm very happy to introduce Sadiq.
Thank you, Layla. It's really a pleasure and honor to be here today with other job seekers. Thank you for giving me this opportunity. Thank you, Tamar. Thank you, Rebecca. Thank you, Leila. I'm really happy to be here. And most importantly, I was a job seeker like everyone on this call. So that experience, what I did and how I find my job, I will share at the end of my presentation. So if you can please start with the first slide. Yeah, so before we dive into US healthcare system, so let's just quickly talk about how the US healthcare system compares to other countries. As there are 200 countries around the world, every country has a different healthcare system, and even there are differences within regions of every country. But generally speaking, in developing countries, there is a very weak health insurance system, or in a country I come from, in Afghanistan, there is no health insurance system at all. And most of the expenses are out of pocket. On average, in developing countries, the out of pocket expenses, or if I frame them in simple terms, the money that we pay from ourselves and nobody else covered, that expense is on average in developing countries around 45 to 50%. But in Afghanistan, unfortunately, which is a war-torn country and is a failed state, the out-of-pocket expenses are up to 75%, and 20% are covered by donors, the aid community, and government covers only 5%. So that's how it works in developing countries, and I'm sure it will be different from country to country. Then we have the OECD, or the Organization of Economic Cooperation and Developing Countries, such as Europe, North America, Canada, United States, even Israel, Korea, and Japan and Australia. So these countries, they have mainly the universal health coverage, where the population in these countries pay premiums proportional to their income, but the health cost does not become a burden on the general public. Then we have the United States. And the United States, unfortunately, is the only OECD country that does not provide universal health coverage, but instead there is a combination of employer-sponsored, for-profit companies and non-profit, and also government, which Tamar talked about, such as Medicare, Medicaid, and also the VA, or the Veteran Affairs Healthcare Services. Next slide, please. And as you know, health is not a standalone issue. It is strongly impacted by our by wealth, education, culture, and there are so many factors that are impacting our health and well-being. So that's why we need to quickly review why United States is different. And the United States is the richest country in the world, and has 330 million population, and 20th century was largely dominated by United States in political, economic, and cultural terms. So that's where the United States is economically and socially. And United States has the largest population of centenarians in the world. Japan comes next with around 80,000. But the United States has the largest population of centenarians, but it's not actually everyone that lives long. But in the US, it is the rich or the affluent communities live longer, but there is a lot of, unfortunately, disparities in the healthcare system that low income or people of color do not even have access to healthcare system at all. And I think I did mention that it's the only OECD country that does not provide universal health coverage. And as you can see, United States, unfortunately, is at the bottom of the list among the OECD countries, and the life expectancy is only 70 8.6, despite spending up to 2 times higher than many rich countries. And it's not everyone living less, but it is a portion of the population that lives a shorter life, and that impacts the life expectancy overall. And here, as you can see, again, it's the graph shows the overall life expectancy, and the United States falls short among the other rich countries. And what is interesting is that from 2014 to 2016 and 17, United States life expectancy did not raise, but it started dropping because of some serious issues in the communities, such as opioid crisis. So the United States life expectancy is only less than other rich countries, but is also start to decreasing. Of course, this graph does not include the pandemic era, which all countries now perform differently. All right, so if we look at the U.S. healthcare system, there are some best doctors and hospitals in the world. If you see, the best doctor in Afghanistan tend to be in the US. The best doctor in India tend to be practicing in the US. So there are some best doctors, best hospitals, but it's only for those who can pay the insurance and who can participate in the US healthcare system. And the quality of healthcare in the US is very high. But on the other hand, the downside is that not everyone has health insurance. Roughly 8% of US population is not insured. It's different from county to county, state to state, but on average, that is 8%. And 12% of those uninsured are under 18 years old. And even those who has insurance, that they are at the risk of paying higher amount because there is no universal health coverage. Even me, I have insurance through my employer, and when I check in, I'm always reminded that, hey, thanks for checking in, but you might get a bill which is not covered by your health insurance. So people, despite having health insurance, they are at the risk of paying more. Okay, and what sets apart the U.S. is the cost. The U.S. healthcare costs are inflated across the board. The hospitalization is expensive compared to other countries. The medication is expensive. The doctor costs are expensive. Even the administrative cost, because the U.S. healthcare system is so complex that the administrative cost is about 8%, and countries like Japan, that is only 1.5 or 1.6%, but in other European countries it differs from 3 to 4%. But in the U.S., the administrative costs are 8% of the total healthcare spending. And in 2017, the United States spent $10,246 per capita, which is twice the average of rich countries, let alone other developing countries. All right, and this slide that shows the allocation of healthcare cost, how it is spent. The private health insurance, those covered by their employers or people purchasing healthcare costs independently, that is about 33%. And Medicare, which is for individuals above 65 and those with disability, that is 22%. And the Medicaid, in California that is called Medi-Cal. That might be called different in every state. That is about 17%, and that goes to the bottom to military and which is the VA, the Veteran Affairs cost to 3.5%. So that is how the overall costs are allocated within the healthcare system. All right, so the U.S. healthcare system, as Tamar talked about, it is so complex. It's I usually present that in the class in the 45 minutes to 1 hour, but I just try to give you a glimpse of how it is. To learn about all of them, it's we may need to kind of have presentations specifically designed for each section, but I hope that gives you an overall idea how the U.S. healthcare system works. And at the end, I want to share with you how I find my job and how I move from one job to another. I was a job seeker like you are in 2018, and in my opinion, the many of us will come from other countries with a lot of difficulties finding ourselves in a totally different environment. But that's kind of I think the case for many of us. But with perseverance, with dedication, with persistence, we end up with having what is right for us. And I think it starts, I'm sure it is explained by AppGlow colleagues, but it starts with preparing your resume, cover letter, and having a LinkedIn profile. That's where you need to start. And I think connecting with people, I know it's during the pandemic, it's a bit difficult, but connecting with people who are more working in the companies that you are kind of focusing and targeting, that's very necessary. And applying and apply to make a good resume and cover letter, and apply as much as you can, because if you don't apply, people don't know you're there. And my last advice will be that if you want to apply, don't target a director or a very high-level managerial position. I'm not saying that don't do it at all, but my advice would be that just try to start somewhere, then build it from there. As it says that success is progress. So progress, just get in, let yourself known to your friends and colleagues and where you work, and then take it from there and move from one position to another. When I started, as Leila said, I was a data collection specialist, but within 1 year, I got credentialed as a PIPD, and later on, I got on a faculty job and affiliation with UC Davis. I hope I haven't talked much, but I will be open to questions if you have.
Thank you so
Thank you
much.
so.
Go ahead, Tamar.
I was just going to ask Sadiq, thank you so much. Could you talk a little bit about how you identified what the right pathway is in the US? I know you worked in public health, but you're also a doctor. Someone just asked what PIPD stands for. So if you could drill in a little bit more specifically, I think that would be really helpful to the folks on the call.
Sure. So PIPD is a principal investigator or program director. That's credentialed status within our organization with my employer, Public Health Institute. With credentialed PIPD status, we're eligible to apply for federal, state, and county grants and do projects of our own. So if you don't have that credential status, for example, National Institute of Health, NIH will not give you a grant because you need to kind of go through a process and tell them, hey, I'm a doctor, I have a master's degree, this is my experience, and a reputable or an established organization should certify that. So that's what PIPD is. And some of the people on this call may know that when you go to the research area, a clinical trial or a other research study, as a prospective study, retrospective study, whatever it is, there should be one person in charge. At the end of the day, that person carries all the responsibilities financially or management wise or from an ethical point of view. So that person is PIPD, because there can be 10 people responsible for one project. So that is PIPD. And how I choose this career, as it was said in the beginning, I'm a medical doctor. I was aiming in the beginning that to become again board certified and practice as a medical doctor here in the US. I bought USMLE books and I was reading them and preparing for the stage 1, stage 2, and the rest of the fun stuff. And I soon noticed that since even in Afghanistan, I was working in public health, I was away from working in clinic, and I was not working in a hospital setting. And I noticed that, okay, the board certification takes me another 5 years, but my bills, my house rent, they do not wait five years. I need to find something to do immediately. And that's where I noticed that, okay, I have expertise in public health. I have worked in public health. I have a degree in public health, Master of Public Health. Then I kind of switched my focus and try to do something which was practical and could pay off. But I think if someone can, if they have family support and they have left their home country from a clinical setting, I think it will be, if they can, that will be best for them to become a board certified. If not, maybe they should choose alternative paths like public health, clinical research, or allied health areas.
Great, thank you for sharing. And we will have the opportunity for more questions in the question and answer section at the end. So more questions to come for you, but thank you so much, Sadiq.
My pleasure.
So in this slide, we pulled this slide from a presentation that our partner Accenture gave last year that highlights the demands of the healthcare field. And you'll notice that there are a top kind of number of occupations in demand, including a variety of nursing positions, nursing assistants, medical assistants, as well as medical secretaries, physical therapists, physicians, and speech language pathologists, among others. In terms of qualifications and pay, you'll notice that over 30% of jobs require 3 or more years of experience, and 5.7 require over 6. Nearly half require bachelor's degrees or higher, and the median income for a candidate with a bachelor's degree in the major metro areas of the US is about $67,000. As an occupation, healthcare jobs are expected to grow 15% between 2019 and 2029. And this is mainly due to an aging population in the US, leading to a higher demand in healthcare workers. Some highlights of top baseline and specialized skills include organization, computer literacy, patient care, CPR, or treatment planning, among others you'll see listed there. And finally, some of the top software and programming skills within healthcare include Microsoft Office, SQL, Python, Salesforce, and just generally CRM, which stands for Client Relationship Management, as well as others. So this is just a snapshot, really, of the outlook for the healthcare industry in the US.
Thank you, Layla. So I don't necessarily have the greatest visual skills, but we wanted to show some pathways. So we know that many of the job seekers we work with are interested in staying in a clinical setting. Many of you are trying to relicense, and some of you, for various reasons, are not able to or not interested. So we thought we'd start by talking a little bit about that clinical space. And the most common first job is a medical assistant. Some job seekers do training or certification. There are some registries where folks can become a registered medical assistant, which is not training, but an opportunity for them to assess your experience and your training as a doctor. And there's a variety of opportunities to get hired into this role. Either some smaller private clinics tend to be more flexible about registration or certifications. And a lot of folks in communities are looking for healthcare providers and medical assistants who have language and cultural skills. The average salary for a medical assistant is fairly low. It's $32,000. It can be a good place to start. But for many people, it's not going to be a good long-term outcome. So as I said, for those who are trying to relicense, who are taking USMLEs, who are going to apply for residency, a medical assistant role can be a great first step to really get US experience, to build some of those skills in understanding how healthcare works in the US, understanding insurance building, a clinical, excuse me, not clinical, but the online practice management systems, and other things that make the US healthcare settings unique. Being a medical assistant is also a great opportunity to practice your English and learn more medical technical terms. So this can be a really great pathway for those folks who start as a medical assistant. There are opportunities to grow in terms of healthcare administration, healthcare IT. There are many roles in data analytics and management. So it is definitely a way to continue to be in healthcare and use some of your clinical background, but grow in a way that's less requiring of licensure and regulation. And then for those of you who are taking USMLEs and applying for residency, this can be a really great first step. Medical assistants can also be a pathway into clinical research or public health. We'll talk about some of those pathways in a minute, but just wanted to put this out there because we know among our folks, there's a lot of interest. There's also interest in moving into allied medical fields, technologist skills in terms of EKG and radiology tech. All of this is of interest and can really utilize your clinical background. There are programs at local community colleges and other training programs, private vocational colleges for some of the certifications that you need. But it's really important to stay clear if what your interest is. So is it to stay in the clinical settings, in which case looking at these various different pathways can be really important, but being a medical assistant or a certified nursing assistant can be a first step into the US healthcare system. And then another pathway, like Sadiq said, is looking at public and community health opportunities. We know that our folks are often very successful as medical case managers. There's need in nonprofits, in refugee resettlement agencies. There may be growing needs in these roles as hopefully more refugees and SIVs and Afghanis come to the US. So keeping your eyes on these opportunities in community organizations, in refugee resettlement agencies. There's also a role for epidemiologists and contact tracers, people working at the city, county, and state level in public health offices. We've had a lot of folks from our program have success on these pathways. We know that there's interest and there's need, and that oftentimes as an internationally trained healthcare professional, you have good basic knowledge of epidemiology and can really go into the field fairly easily. And also, many of you have done the Masters in Public Health. We know also on the community level, there are community health workers. In Chicago, there's a very well-established program of community health workers, and one of my job seekers just got a job working in this field. We know there's a need that, as we discussed, that the system is very complicated and everyone isn't getting as much access to healthcare as they need. And community health workers are a great resource of people who come from communities, who speak the language of the people, who understand the cultural status of people, and can help bridge between individuals and communities to hospitals and healthcare providers. So these are really fabulous career pathways to look at. If you have interest in any of these, definitely talk to your advisor, and we can find folks who've been successful to connect you to for informational interviews and more information about how to move in these directions.
Another career pathway that we wanted to highlight is in clinical research. So to start off just with a definition of clinical research, it's research in which people or data or samples of tissue are studied to understand health and disease. And clinical research helps find new and better ways to detect, diagnose, treat, and prevent disease. It's a growing field. So according to a report by Grandview Research, global clinical trials market size is expected to reach $69.5 million by 2028. It's best if you enter the clinical research field with a background in healthcare, but there are also paid training programs out there that will allow you to enter the field without a background in healthcare. Looking at this graph here, you'll see a career pathway in clinical research that allows you to start off as a clinical research coordinator and to earn a higher salary with each promotion. So starting with clinical research coordinator, people in this position tend to work at clinical research sites and coordinate daily clinical research or clinical trial activities. So according to Glassdoor, to give you a sense, the national average salary of a clinical research coordinator in the US is around $54,000 per year. And of course, this varies by location, whether you're in one of the major cities that has a higher cost of living. From this position, you can transition into working as a clinical research associate. There's also the potential to earn an official certification as a clinical research associate. And to apply for this type of certification, for example, with the Association of Clinical Research Professionals, which is a leading clinical research association, you would need 3,000 hours of professional experience in the field within the past 10 years, among some other qualifications, just to give you a sense of what it takes to earn that type of certification. With a promotion from there, you can become a clinical team lead. And adding on another promotion, you can take on being a clinical trial manager, making between 109,000 per year, which is, of course, the national average. So again, widely varies according to your location. We also are very happy to say at UpGlow that we have CITI, which is CITI, clinical research trainings, which are completely online, self-paced courses. We are able to offer 16 total courses through CITI on topics ranging from clinical research foundations to health privacy, HIPAA regulations, to good clinical practice in clinical research. Contact your UpGlow job advisor if you're interested in enrolling. Lastly, the healthcare team is also happy to say that we have 2 upcoming webinars on CITI and clinical research this fall. So stay tuned for an invitation that you will receive over email. Another pathway that we wanted to highlight is medical billing and coding. And so you may kind of think, what does a medical biller or coder do? So they organize and review patient medical records, assign codes for each diagnosis and treatment. So it's very technical, very much attention to detail. They prepare coded information that healthcare insurance can use practically or for research. And in this job, one may retrieve information for clinicians and billing offices. Typically, folks in this position work in healthcare facilities. So to become a medical coder, you need to complete a certificate program or a 2-year associate degree, which are often offered at your local community college. And top skills for this job include customer billing, medical billing, medical coding, ICD-10, which is the standard transaction code set for diagnostic purposes under HIPAA. This is something you would learn if you did a medical coder program. Customer service, claims knowledge, communication skills, detail-oriented, organizational skills, multitasking, research, and of course, computer literacy is also very important within this field. So this is a very in-demand kind of occupation within healthcare, and there's a 1.3% projected growth in the next 10 years nationally. You can see the median number of job postings have an annual salary of $37,660. Sorry, that's the median salary. And there are around 26,000 job postings in the last 12 months for these types of positions. They typically, within those job postings, ask for 0 to 2 years of experience, around half, and the other half is around 3 to 5. So it's actually a great field to complete that certificate or that associate degree and then actually enter. It's not one of those fields that you may find job postings that require lots of years of experience. And for the education level, 85%, around 85% ask for a high school degree. So think high school degree plus certification program, although 10.2% require an associate's and a smaller percentage a bachelor's degree. So it's actually completing an associate or a certification program with your background in medical knowledge can be very appealing. And I actually have an UpGlow alumni working in this field who says that IMGs are always kind of especially considered because they have that extra background medical knowledge. And so when they see terminology or doctor's handwriting, they can easily kind of figure out what it means. So that's a snapshot of medical billing and coding. So for resources, Tamar, did you want to jump in and kind of talk about some of the resources we have?
Sure. And I've been watching in the chat, there have been questions, and we know that we couldn't cover every pathway in healthcare, and there's lots of variety and opportunity. And what we really wanted to do was give an overview based on our experience. Layla and I have both been at UPGLO for a while now and know, areas where folks in healthcare have had success and interest. And we just want to encourage you to continue this conversation with your advisor. And if there's an area that we didn't mention that's of interest, maybe we'll get a chance to talk about it. I'm going to do a quick overview of these resources, but I do want to leave some time for us to answer questions. We know that all UPGLO participants have access to Coursera. There's a great course there on healthcare organizations in the health system. And we'll be sending out this recording with the slides, so you'll have a link directly to the course. And so that can be an excellent next step after this webinar. We also have other webinars that we've done in the past on medical residency, clinical research, public health, and healthcare career pathways. We will be sending these out, and we also can share them, have shared them on our Slack channel, and can individually send you if you have additional questions. I also know that a number of you had asked about health insurance, and there are tons of resources on the web, and this was a very clear page about how health insurance works in the US. So I wanted to share this link. And then finally, Upwardly Global has developed a big list on our website of resources for folks who need help with housing or healthcare or any other of the many services that UPGLO doesn't provide. So please have a look at that if you have individual questions. And your advisor can also help link you to specific resources in your community.
Great. So at this time, it's open to questions. Please, go ahead and enter questions in the chat. We already have some, and the first one is for Sadiq. If you can provide insight on how one would go about getting that PIPD certification or licensure.
That's an interesting question. I guess that can be done in other states and other nonprofits and organizations as well, but in Public Health and Institute, what I will do is that right now I don't have that link handy, but what I will do is to share that with Layla and share it with everyone. And for the Public Health Institute, you can reach out to our organization, share your information. They usually review it within 3 months, I suppose, something, but sometimes it gets longer. If you're qualified, then you will be approved as a PIPD. But I guess that can be done with other large research institutions as well.
Thank you. Another question we had was, what about NP, so nurse practitioner? That's a great question. Nurse practitioner is one of the nursing roles that was highlighted on the slide as a top occupation in demand. So you'll see, I believe nurse practitioner was listed here. Or perhaps, no, I'm sorry, it was registered nurses, critical care, licensed practical nurses. I believe that nursing in general, I want to say, is very much in demand because of the pandemic and also because of the aging population in the US. So nurses can be hired through, with home health care agencies or nursing centers or nursing homes. So I think as a whole, the nursing industry, the nursing occupation is very much in demand. And does anyone want to add anything to that?
Sure, I'll jump in. Thanks, Leila. Yeah, so to be a nurse practitioner or any advanced practice nurse, you generally need a master's degree. And to be a nurse, you need training as a nurse. So you can't, if you're a doctor, simply license as a nurse in the US. You have to go through a program. There are some advanced practice there are some shortened nursing programs you can do that do recognize some of your past studies and work, but they're not as many as we'd like. But as Leila mentioned, there's a ton of demand and need for nurses. So if you're open to reskilling in that area, it is highly likely you'll be able to work in a clinical setting. The nurses in the US have a lot of responsibility. They see patients, they can, nurse practitioners can prescribe medicine. So there's a ton of growth in the area. If you have been trained as a nurse in another country, it's a fairly straightforward process to relicense, and we are happy to work with you on that. So lots of interest in nursing out there.
Great. And we have another question from Christine, who wrote, I tried to start from lower positions, but I faced the situation of being overqualified. How can I convince them that I can start from there?
I can answer that if you want me to. So I do a lot of work with our employer partnerships team, and we throughout the organization do a lot of work trying to educate employers about many of the barriers that our job seekers face, including this issue of overqualification. We have a diversity, equity, and inclusion working group, for instance, with about 50 or 60 major corporations where we're doing education around these issues, sharing best practices, et cetera. So that's just one example. It's really difficult work sometimes, but we're trying very hard. We educate recruiters directly. We try our best to advocate you and to build up relationships when possible. But we know it's a barrier. Tamara, is there anything more that you would want to add about that?
Sure. So as Rebecca mentioned, we're working institutionally to address these barriers, but we want to also train and empower you all to be able to connect with professionals, with employers, and explain why you might look different from other people who are applying for a medical assistant or a research assistant role, and help you to be that advocate, to be able to say, yes, I understand don't look like your typical applicant. I'm really excited to do this work. I have the skills and training. I know within your university or hospital or company, I will have ultimately opportunities to grow, but this is a great job for me to start. So it's a both sides working, and also giving you opportunities to network with alumni and volunteers who will help make your case to strengthen that application when you do look overqualified. And we certainly know it's a big challenge. One of the exciting models that we are working on in healthcare is we have a very strong relationship in New York with New York Presbyterian Hospital, and they've created a program where they're bringing in up to 100 of our job seekers in internship roles that are well paid to try to help them understand various pathways. You know, I think in healthcare in the US, there's a strong acknowledgement that we need professionals. Any hospital you look at has literally hundreds of jobs posted, and we all need to work together to help our hospitals understand how internationally trained health professionals can help meet those needs, and how, you know, there are pathways and ways that even as someone who's may appear overqualified, you can jump in, you can support, and then within the institution, you can grow.
Thank you. And another question we received from Babak is, are there free courses for Ctpm? I'm not sure what Ctpm stands for. I haven't heard it in the medical term sense. I'm not sure if anyone, maybe you can clarify, Babak, or I'm not sure if anyone's heard of that term. And again, it's
excuse me, clinical trial project manager. Clinical trial project manager. Yes, sorry.
Okay, yeah. So what are there any free courses to become a clinical trial project manager? So on the career pathway we showed, to become a clinical trial manager, you typically need extensive experience in the clinical research field. There are some great articles online that can actually show you the backgrounds and the qualifications of some clinical trial managers to give you a sense. There are different pathways of getting there, but typically this is a great pathway if you wanted to start out in clinical research and achieve promotion to that level. From what I've seen, typically it requires, I want to say, like 10 plus years of experience in the field. You have to have very extensive knowledge of clinical trials, how they're run. And it also sometimes can include managing the budgeting side of the clinical trial. So I would say that this can be a great pathway to follow. We do have free courses in clinical research through CITI. If you haven't already signed up, I would recommend reaching out to your job advisor. And Tamar, Kiri, Ari, or Rebecca, anything to add there?
Thanks for answering that, Babak. We can definitely be in touch about the CITI program Leila mentioned.
Yes, thank you.
Thank you all for joining. Looks like we're at time. So wanted to say thank you so much for joining the conversation today. And as Tamar mentioned, we will work on getting a copy of this deck and the presentation to you in the next few business days.
Just to echo, Leila, thank you so much. All the job seekers were here, and special thanks to Sadiq, and wishing everyone good luck, and have a great day.
Thank you.
Thank you, Tamar. Thank you, everyone.
Thank you so much, Tamar. Thank you for everybody. Thank you.
Hello? Hello?